When you think of artificial intelligence, also known as AI, what do you think of? Is it robots? For most people, that's what we all are mostly used to seeing when it comes to them. There are evil or good AI robots on TV or in movies, and then we have AI acting as non-playable characters in our favorite video games. But this is woefully incomplete and inaccurate picture. Most artificial intelligence is invisible to us. It works on our iPhones, on Amazon, in our home thermostats, and soon throughout medicine. By entering the new age of computers, humanity has achieved, yet again, a tremendous milestone bound for exponential growth. Artificial intelligence, also known as machine learning, is a sort of computer program that can develop its own intelligence without the aid of a human programmer. Rather than using programming to instruct a computer every step of the way, if X, then Y, we instead give computers a huge set of data and instruct the computer to essentially figure it out. There are many different kinds of algorithms that machine learning programs can use, such as classification or regression, but the most popular trend would undoubtedly be the DeepMind method. DeepMind is a learning program used to train an AI to play the game of Go, a Chinese game of strategy played across the world for over 2,000 years. Using this programming, AI learned to beat the world famous, literally undefeated Go champion, Lee Sedol. Unlike other popular classic board games such as chess, backgammon, or checkers, the game of Go has astronomically more possible outcomes than any other game. In numbers, the number of possible moves in chess is 10 to the power of 123, while the number of possible moves in Go is 10 to the power of 360. To show how fast of a number it is, scientists and mathematicians have estimated the amount of particles there are in the observable universe to be 10 to the power of 80. To create an AI algorithm that can strategically maneuver the world's best human mind at the game of Go is an incredible feat for machine learning research. After Sedol's defeat in 2016 by Google's DeepMind team, the hype for AI research skyrocketed, with many envisioning a prominent future for it among medical practice. One such effectively proven application would be skin lesion identification, a pre-indicator for chronic illnesses such as diabetes, autoimmune disorders, and precancerous changes. A recent 2020 research into AI identification of early skin lesions showed an accuracy rating of 95% in correctly identifying proven images of skin lesions when compared to experienced dermatologists at an average accuracy of 90%. In order to make this possible, the research team had to get thousands of examples of different skin lesions and another large group of normal skin conditions. They input this huge amount of data into their AI and simply stated if the picture was a skin lesion or not. The more machine learning program got used to characterizing the details of a normal skin field compared to those of an early developing lesion, the higher the accuracy rating for correctly identifying new sample pictures. Another machine learning research program by MIT has recently helped develop a method to detect early developing COVID-19 symptoms by analyzing coughs. The researchers trained the model on thousands of examples of coughs, as well as spoken words as a reference, just as in the skin lesion program. When they fed the model new cough recordings, it accurately identified 98.5% of cough from people who were confirmed to have COVID-19. And it was also 100% accurate in identifying coughs of people who were asymptomatic. You may be thinking that with the incredible potential of AI technology, It could possibly replace our medical professionals, but that is far from the intent when it comes to machine learning research. Our doctors and nurses, most important trait that computers may never achieve, no matter how far advanced technology has improved, is the natural human trait of emotion. The existence of empathy itself allows for the best possible treatment of patients because not only can a well trained medical professional with compassion heal physical wounds, but he or she can also heal emotional ones. Disregarding external social factors that may cause social complications could even create a butterfly effect and worsen their condition in the future. Thus, AI's main purpose is to simply support our medical staff so that they can provide further undivided attention towards their patients so they can receive attention they need so dearly. Take, for example, a consultation with a patient with type 2 diabetes where the clinician needs to take a large amount of time to read outpatient letters, review blood tests, and read medical guidelines from many separate systems. AI can automatically review and summarize patient data and suggest the risks and best possible actions to take according to an analysis of thousands of similar cases and their known outcomes, saving the clinician a significant amount of time. Similarly, according to British Journal of General Practice, there is currently an ongoing clinical trial using machine learning to calculate target zones for head and neck radiotherapy that is far more accurate and quicker than the human being. An interventional radiologist is still ultimately responsible for delivering the therapy, but AI has a significant background role in protecting the patient by minimizing harmful radiation. Artificial intelligence can help make our medical system more efficient, and not a moment too soon. As people age and the world population continues to grow, demand for medical service is surging. Our current amount of clinical resources will be challenged to its limit. With the help of machine learning technology, perhaps with further development and acceptance, AIs can help with patient assessment and decrease the workload pressed upon hospitals. A single AI system can analyze a vast amount of data, therefore becoming an excellent substitute for situations where poorly resourced areas, where human expertise is a scarce resource. For example, in many countries where tuberculosis is prevalent, there's sometimes a lack of radiological expertise, especially in less populated areas where there are few healthcare specialists for patient treatment. By using AI, radiographs could be uploaded from these remote centers to be interpreted by a single system, offering a very accurate analysis of the X-ray. According to a 2009 study, an AI can correctly diagnose pulmonary tuberculosis with a sensitivity of 95% and a specificity of 100%. With machine learning, remote patients could receive the necessary treatment they need while also reducing the unacceptable times waiting for a busy traveling physician. We may be thinking that machine learning could possibly figure out how to do nearly everything a professional can, but in reality, AIs have a very strict method of learning. The successful development of machine learning models relies on relatively stable and consistent data. There cannot be many outliers. These programs need to have concise and proper data so that they learn how to solve them the same way they always have been for the thousandth time. To put this into perspective, imagine learning piano for the first time and you heard this song called For Elise by Beethoven that you really want to learn. Now imagine that after a day of practice and you return to the piano seat, the music you just played yesterday has a few notes off from how you used to remember it. Despite the change, you continue to practice For Elise, assuming that it was originally written like that you may have been imagining things. After another day of practice and you return the following morning, you notice that your piano is now missing a couple of keys and is not at standard tuning. This is an analogous scenario to demonstrate how inconcise data can alter the machine learning process to reach its desired goal. And in this case, to learn how to play for Luis. Within the medical field, it is very common for there to be unforeseen circumstances where improvisation may be necessary to save a life, in which AI was never modeled to analyze. So while AIs similar to Fitbits are becoming advanced enough to analyze incoming data of an individual, create clinical records, and possibly suggest a doctor office visit, machine learning cannot replace the healthcare professionals themselves. Clinical staff will always remain the strongest and most important pillars to a successful patient care system. It is them that have the compassion, the empathy, and the creativity to treat the people. AI technology can incredibly improve the quality of medical care, but don't worry, we won't be greeted by a robot the next time we go for a physical. In the near future, when we think of AI, we shouldn't just think about the Terminator, iRobot, or all the funny NPCs we mess around with video games, but about the astounding human innovation it is. With the further development and proper application of AIs, civilization can yet again reach another milestone in human history. A milestone in which quality, efficient medical care is available to everyone. Thank you.